I want to thank you so much for watching this video. It's really, really important conversation that I want to have tonight. You know, so many of you have sent me things, videos, and asked me questions about medical things and scientific things. There's basically two problems with you sending me stuff like that. Number one, I'm not a doctor, and I am not a scientist. I'm a pastor, and have been doing that for a long time, but I do know my limits. Now, there's a second problem too, that so many of the videos that have been sent and so many of the different things that you guys have wanted me to give my position on. Well, like I said, first of all, I'm not a doctor or a scientist, but secondly, not one of these people on the videos is someone that you know or I know. We don't know, and because we don't know them, especially we don't know them enough to trust them at all. We really can't know their agenda. We can't know what their motives are, what their thinking might be. We do know that on many of the platforms that these come, the more views that people get, the more money that they make. And so you have to understand that sometimes very controversial things or a very controversial position on something or a very, even an outrageous thing, what's going to get you not just a few views, it's going to get you maybe millions of views that people will look at it and they'll say, well, look at this. And I do want, because of that, I've told you, you need to talk to somebody that you know and somebody that you trust. And that's what I try and do as well. So I have a special guest for us tonight. Someone that I know and someone that I trust and someone that a lot of you know and trust. He's a good friend as far as, and he's actually my doctor, and he may even actually be some of your doctors. He may be the doctor that you see. And so I do want to make clear that he will not get paid one penny for this interview. And of course, I won't either. So I want to take a few moments as soon as I can get him on here to bring to you a list of questions and a conversation with Dr. Rob McElhaney. So hold on just a moment. It may send you something. Okay.
Like
there
a
you
link
are.
or something.
Welcome. Rob, I gave a little introduction about that I wasn't a doctor because people ask me all kinds of medical questions, and that I'm not a scientist. That wasn't my strong point. We'll leave it at that. But you spent a lot of time. I think wasn't you before you got into medicine? You were like, weren't you? You were more into the science side of it, right?
Yeah, I did undergraduate chemical engineering and chemistry at the University of Washington, and then Becky and I moved out to Midland, Michigan, and I spent 7 years as a senior development engineer at Dow Chemical Company.
So you've kind of seen the whole chemical side of this, the research side of it, and then you ended up kind of through some kind of amazing turns of circumstances, ended up going into clinical medicine, right?
Yeah. There was a lot of different issues. Corporate America was fun for a couple of years, but when I tried to project myself doing it for 30 years, it wasn't real exciting. And my brother was going to medical school at the time, and that got my interest peaked a little bit. And then one evening I came upon a lady in a fatal car accident. It was a bad winter night and pitch black, and I felt pretty helpless in my ability to assist her. And I think, the Holy Spirit was just really working with me, and I started to really consider the possibility of going to medical school. It was interesting the way it worked, though, because as I pursued that, I think God really initially had the door closed. And then AJ, our son, was born, and we went through a year of challenging times, but also tremendous, I think, spiritual growth. And God took me really away from the scientific side that was really my strength throughout a lot of my life, science and technical stuff. And he really grew the spiritual side and my ability to love other human beings regardless of their physical or mental or spiritual circumstance, just to look outside of science, if you will.
Well, I remember being at the hospital one night. I'd taken somebody to ER in Longview, and it happened a bunch of different times. And I said, I came out of the hospital, it was like 3 a.m. I said, God, you got to bring a doctor around here. I can't keep doing this. And I think it was a few weeks later that you and Becky and the tribe showed up. So we've been grateful to that. And but it is a big difference. I mean, you were in the scientific side, and I know that that's still a big approach for you. But then you also have done a lot of you do clinical medicine. I mean, family practice is pretty wide open, and I know you've worked in the hospital a lot, and I also know that you've done some overseas work. You guys have done some work in Haiti. It's been you've had a pretty broad spectrum, and you kind of I'm just saying that your experience has been pretty broad as far as dealing with different medical kinds of circumstances, different kinds of situations.
Yeah. I think that's one of the things that I love about medicine that's fascinating, is that it's not just Marcus Welby and surgery, or not just ER, or, I mean, the realm of medicine is pretty broad. And certainly if you're practicing overseas in missionary medicine, it's a lot different environment than we have here. But some of the skills that you use and some of the qualities that you look for with somebody in medicine who you want to be helping you are the same.
I was going to say that it seems like there's so much information out there for people now, even in the last decade, that people have access to all of this. There's a lot of websites, some good and some not. There's a lot of videos on YouTube about one thing or the other that, especially during this COVID-19 thing, have gone around. And just variations. There's so much coming at people in the middle of all this. And I know that you are a believer and that you have a strong faith, but I also know that, I mean, the bigger question would be like, how do you have your faith intersect with science and with medicine in the middle of all this, especially during this time?
Yeah, that's a great question. I think science is a method used to judge things, and it's a very fixed approach of how to judge things. There certainly are other ways besides science. You can use, I guess, intuition, or you can use a spiritual connection, or there's other ways to judge things. But I think, as I alluded to with my own growth before I got into medical school, there's a lot of things that science can't do. And I think where those intersect is there's a lot of things that I can't explain or I can't know for certain. And in those areas, I think you have to rely upon your faith. And even somebody said, no, even if somebody says you have to dig further into science, at some point you reach a point where you have to have faith. Now, somebody may not call it that, but there's, science can't explain the world. And personally, I don't think that it ever will 100% until heaven, and then our eyes will be open.
But then there's the other side where it seems like there's almost kind of a dismissal of science or of any modern science. I mean, people are confused because they hear one, quote, expert say this and one other person say that. And so it seems like there's this kind of, sometimes, especially with people of faith, that they just don't take, scientific proof, especially when in terms of medicine, very seriously, or they doubt it.
And I think science as a tool to judge things, there's different levels of science. And unfortunately, there's also a lot of people that prey on other people, whether intentionally or not, but there's other motivations that people have. And when people get desperate, or when people look for theories or explanations that fit their desperation or give them hope, then I think sometimes they go out of the scientific realm where it can be properly measured. There's a lot of things that I would call anecdotal, meaning your father drank coffee all of his life and he developed dementia. Therefore, don't drink coffee because it causes dementia. Well, how do you prove or disprove that? And in science, there's a very concrete way where you can develop a theory like that. And it's okay to have a theory developed on anecdote, but then there's ways to test that through statistics and through setting up experiments and getting proper numbers to support that. And sometimes science even goes out of that realm. And that's what I say about the quality and the strength of studies. The more that you get into science, the stronger the tools are, but the more complex they are. And
it seems that one of the things, especially about this time period that we've been in, because nobody's been through anything quite like this, and it's created a lot of stress, a lot of people, a lot of uncertainty, a lot of confusion with people. I hear it a lot from people. And of course, plus because many people were not working, or they were working from home, they had a lot more time on their hands to come up with, just surf around. But do you think that the stress, because I know as a family practice doc, you probably see a lot of people with stress and anxiety. Do you think that stress makes people more susceptible to maybe bad information?
No question. I think the stress pushes us in part to look for hope. I think a good example that maybe a lot of people can relate to is somebody that develops cancer, and you look for a cure. And medicine and science allows you treatment, but it doesn't always allow you cure. And so sometimes people get desperate then, and they find answers, and those answers provide hope, but they don't always provide a cure. In fact, frequently they don't, because they're not scientifically supported. And sometimes the basis of those are, the roots of those are with somebody who's really preying on people to get money or something else. Sometimes it's legitimate people, they really do believe in what they're doing. But I guess as a scientist and as a physician, using a basis where I can judge a result is kind of my framework. No.
You'd think that maybe some of it too is that people just want to feel like they're in control. They have some control. I mean, this is so big, and sometimes it seems so far away, especially in rural communities that at least at this up to this point haven't been hit as hard. It just seems like they want to get a handle on it, and they want it to make sense with what they're seeing around them.
Yeah, no question. No question. When you, especially with this particular pandemic, we're hearing that the world is crashing in, but yet the environment around us doesn't always jive with that. And so that can be one of the false senses of security, is to say, trust your own judgment. You know, what's your intuition telling you? And that's not a bad thing, but you can't turn a blind eye to science either, because the facts of this disease are such that I think one of the reasons we've had success, and one of the reasons why it hasn't just taken over the country, is because to a great degree people have listened, and they've done what they needed to protect themselves and their families.
So I'm going to assume, though, then that you don't think that COVID-19 is just a hoax,
No,
because a
no.
lot of that been said.
I think if you just look at our immediate environment and trust your intuition, you might think it is a hoax. But I think unless everybody coming out of New York and everybody coming out of Italy, you know, and some of these other places where it was much more catastrophic than here, I think unless there's a whole bunch of people in on the hoax and conspiracy, which I tend not to believe. You know, now I didn't experience it firsthand. And so, you know, I mean, some people would say the Holocaust is a hoax, and there's a whole bunch of other issues that are hoaxes, but I don't think this is a hoax.
Well, what about this then? The other thing, the common thing that people ask me about is, well, don't you think this is just way overblown? That, you know, it's blown out of proportion. Lots of people die from the flu. And so now at this point, there's like 4 or 5,000 people that died of COVID. You know, people die from the flu. So, you know, isn't this overblown?
Yeah. So I think it's not as bad as it could have been. I would agree with that. But what the science and statistics would tell you is that this is about 2.5 times more infectious than the flu. And hospitalizations are, you know, maybe about 1% with the flu get hospitalized, 20% or 1 in 5 with this get hospitalized. The death rate from the flu is maybe 1 in 1,000 or less. The death rate from this is 1 in 100 or more. So it's more than 10 times deadly and 2.5 or 3 times as infectious. So that's the science, and those are facts. And you know, you can say, yeah, but it's not killing a lot of people around us. Well, then what do you attribute that to? I attribute it to people making good decisions.
Well, and if I don't, is it, but I mean, even though there's like, let's say 108,000 or 104 or 5, depending on, I'm not sure as of today, but you know, and however normal people die of the flu too,
Right.
is my understanding.
Right.
Yeah. So, well, how has this affected you? Like, this has all affected a lot of people, but a lot of times people never think about how this has affected, you know, providers and how they deal with patients and just in their own life.
Well, you know, there's from my practice standpoint, there's a lot of different facets to that. There's how I'm dealing with patients. I have employees because it's a business, so I'm responsible for their safety and their employment. And then my business itself, and how we sustain that, how I make payments on the clinic and buy supplies and get safety equipment and that type of stuff. So as far as the business goes, like many businesses, initially things really started to taper off, and I started to have to think about how are we going to make it through this and how long is it going to last. Then there was actually an uptick, in part because of the disease and people wanting to get tested and people that were legitimately scared. And now we've kind of reached a status quo where we're doing a hybrid of our traditional evaluations and treatment of people's chronic diseases, as well as continuing to evaluate their antibodies and evaluate their respiratory symptoms.
Because you've been kind of on the front end of the testing side of this, right?
Yeah, we're one of the only facilities in Lewis County that is doing both active testing as well as antibody testing. So
why do you think that, like, as far as, our area, why do you think that we've seen less cases in Lewis County than maybe other places?
I think Lewis County has a certain amount of social distancing already. I mean, a lot of times people come to Lewis County because it's a little bit more country. They don't want to live in Olympia, let alone Seattle or Portland or a more populated area. We don't have as much mass transit. Our grouping of patients, whether it be church on Sunday, we don't have a mega church. I love our church, but you're not going to see 40,000 people seated in there. Our football games have 100 people instead of a couple thousand. So, I think we do a certain amount of social distancing already. And I think that's a fair argument as far as even how you treat the disease when it comes to people's personal lives and businesses. You can consider that, and I think that they're trying to consider that as they decide, should we open back up things? But how they're considering that is the fact that we've had fewer infections than many of the surrounding counties, and that's partly what I attribute it to, is that we do have some social distancing, and which is obviously a great way to avoid the disease.
And of course, I've had way more people be concerned about like meeting too soon than being a little more
I'm gonna see if
a little longer. You're gonna shift around a little. That's okay. We'll be out here. We'll have to build a fire. I don't know if your fire will heat me though.
Yeah.
This distance.
Hang on.
Okay.
We got to get some of this gorgeous sunset into this if it'll pick it up.
I know, but
Gonna be.
You'll look like you're a Martian there.
I'm gonna glow.
When you think about this overall, like where we are right now, June 1, what concerns you most about this pandemic at this point?
You've kind of hit on one of the things that concerns me the most, and that's people's responses and the breadth of their responses. I guess what I would love to see is some type of coming together, as you've preached about, in some type of coalescence. But in some realms, it's actually driven some people apart. It seems like there are camps of extremes, and whether it be that they think it's a hoax, or worse, that it's not a hoax, that it's a government conspiracy of some sort and a power grab, or whether we need to hide in the house for years until it's gone. I think that there's just extremes all the way around, and instead of a coalescence, I think to some extent it's a war, but it's a war that everybody in our generation hasn't been exposed to. It's not like World War I or World War II. Those actually really unified the country to a great degree and brought people together. This is a different kind of war that we've not been exposed to, and you can read about previous pandemics, but it's hard for us to relate to.
So like in if you use the warfare analogy, I mean, it was there was a lot of shared experience, but this is not so much. Do you think that the lack of shared experience with loss or the lack of personal experience with COVID, either personally or in your family, has made people just kind of more lax or less concerned about it?
Yeah, I think that's played a part of it. But equally, an equal part is, as you alluded to, technology and the spread of communication and availability of uh, memes and all, whatever you can latch onto to believe in. And we talk a lot about science, and there is science, but there's a lot of political science too, meaning meaning something completely different. Meaning,
Mhm.
you take something and twist it to fit your ideology.
Well, when you think about it from just the medical side of it, what do you think the best prevention from? I mean, this has been, people have heard it, but what do you think the best prevention is from catching COVID-19?
Avoid it. But how do you avoid it? So
I
I
want
mean,
to. I'm trying.
so social distancing, clearly, everybody's hopefully by now heard about a 6 foot circumference. Um, Hand washing, even, I mean, new data, new information, new studies are coming out every day, but hand washing has still been at the forefront.
You
what,
think
what
that
I'm
these new
reading,
studies, though, I mean, I realize this is a novel corona. It's a new thing,
right?
but um, and a lot of I've heard other physicians say maybe by July or August they'll understand it more. But do you think that new studies coming out every day creates part of the problem? Is that people hear all this new information and they think, well, these people don't know what they're doing. They're
I don't.
changing all the time. They tell us to do this and they tell us to do that. And
Yeah, yeah, and I mean, that's true, and maybe that leads to a degree of skepticism on people's part, but it's more dangerous than to just look for things that fit your ideology, because um, yeah, science is evolving. It takes a while to study these kinds of things, and I mean, how quickly we can study it now, to me, scientifically, is truly amazing. We had the RNA, we had the genetic sequence of this virus before it even came to the United States. I mean, before Watson and Crick in the 60s, I believe, we didn't even know what DNA and RNA was. And now to be able to map out a genome that quickly is astounding. And I think, you know, maybe we were born too early, because I think 20 or 30 years from now, this kind of thing will be less of a threat to us, because if we allow science to evolve, our ability to produce a vaccine won't be a year and a half, or won't be 2 years. It'll be 3 or 4 months. So we'll get a sequence, and we'll be able to have more of a prevention earlier on, a better prevention. Hand washing is
well,
great, and that'll
and
probably always remain a
And of
mainstay.
course, though, there are these, as far as like social distancing issues, and you're talking about, your big concern is that there's a lot of lines being drawn and people making issues about stuff that is more about just prevention than it is about anything else. Um, you think that's kind of how this whole issue with masks have been such a big deal? People saying different things about it, that to mask or not to mask, that is the question.
Yeah, well, I think early on, because we didn't know a lot, obviously in healthcare there was masks, and the goal of those masks was predominantly to try to protect the healthcare provider. And what they learned pretty quickly was healthcare providers were still getting very sick at a high percentage. And so then they started questioning, well, do masks help you? And with the right type of masks, then they can help to prevent. However, um, they were very limited in supply. And so I think initially the government said that medical people, we needed to preserve masking for medical people. And as it evolved, we're still trying to preserve the highest grade masks. However, what they learned was masks don't do a great job of preventing the people that are wearing them. What they do is protect you from droplets. There's different degrees of respiratory droplets. You know, in a sneeze, there's like 30 or 40,000 tiny particulates that get sprayed out. In a cough, there's many hundreds, you know. And
Well, what about
so
singing?
in singing, you know, I mean, many of you have read about a church up in the Seattle area where even after the pandemic started, they gathered and they social distanced appropriately, and all they were doing was singing. And 2/3 of those that joined the choir came down with COVID, and they tracked it right back to that practice. So even singing loudly, it can spread. Now, if you
So
sing like me, you won't have to worry about it.
you're just mouthing it though. You're not even singing.
Who said that?
You're just moving your mouth. Well, what about, so, you know, we have a lot of people in our church, both young people and some older people, even kids who have had, you know, health issues. Would other people that maybe that's the other thing, is it sounds like you can have this and be contagious and you don't have any symptoms. You don't even know it.
That's true. And
So if you're
so,
that person and you don't know you're sick, or maybe you don't have much of a sickness, because we've had some folks in our church that was true, and they come to a church service, would, in a case like that, let's say we got somebody there who has cancer, they're being treated for cancer, they're on chemo, they're maybe a kid that has a suppressed immune system, and they go to a church service, maybe a guest, or maybe, who knows, you never know. If you have a church service, you don't know who's going to come, no matter what you say. And would people wearing a mask protect someone with that kind of vulnerability?
yeah, no question. I mean, there are studies that already show reduced spread with masking, you know, and there's a lot of other information out there. People are scared about breathing in their own respiratory air, and won't that create infections? And, you know, there's a lot of reasons why people try to justify not having masks, but the science shows it does reduce spread. It's not perfect. Some studies I've read show that it can reduce, if everybody masked, it would reduce spreading by maybe 20%.
So
That's not perfect. I wish there was 100%, you know, but
do you think, like, if meeting outdoors, that's kind of what our initial plan had been, is a little bit is better initially, for as far as the whole spread type thing?
yeah, you know, I think clearly that would allow more social distancing, and that's even more effective than masking. And so I think the more that we can come together but stay apart, the safer it'll be. And
Windstorm
being
would
that
help.
we're coming up on the best 3 months of the year in Washington,
We could have
I
like a
like the
windstorm at the same time. It'd be even better, right?
yeah.
In your case,
It
though,
depends which way it's blowing.
you're not
Trust me,
really a singer. You're
I've
not really a
tested.
singer, so. But if people are gonna sing, and here's my thinking is, you know, you meet outdoors, and people are supposed to kind of keep social distance, but people get together, they're gonna hug on each other, and they're not gonna be able to keep, not because they're bad people, they're just not gonna be able to help themselves.
Yeah.
So is it kind of like a belt and suspenders thing? If people wear both a mask and they're outdoors, it might be just that much safer for, you know, we have like people that go in and they get surgery and they're going to come to church. I mean, if you have a in-person service, they're going to show up. And, you know, it really does, for me as a pastor, it really just concerns me, because I just don't want to be, you know, a huge part of our relationship with people is to try and never do them any harm. I
Yeah,
know
I think
it's tough for people.
in the US, you can, you know, for those that are media savvy, if you go on search right now, there are churches that took it upon themselves to try and go around some of the government edicts, and there are churches where people that felt fine came out infected.
Yeah.
And so I think the approach of trying to make it as safe as possible is the right way to go.
Okay, so here's the money question. Ready? This is the
Yeah.
money question. Would you wear a mask?
Yes, we do in the office, and we only ask healthy people to come in right now. And what I mean by healthy is there's signs on the door saying if you have anything respiratory or any fever, we're happy to evaluate you in the parking lot. But in spite of that, all of our employees mask up in the clinic when they're in contact with you. And I'm one of the 20% that wears it into Home Depot, even though it's not required. I think partly out of respect for other people, because I don't do it because I believe it protects me. I think the science and the data shows that that's not the case.
Yeah.
But
Yeah.
it's because I don't want to feel like I've not done everything I can to protect those around me.
That's a good point, because that's what people say a lot to me. Well, it won't keep you from getting it. But it seems like what you're saying is that it's not really about you. It's about you not giving your potential infection to somebody else that you might not even know about. And I think that's a really Christian idea, that don't just look out for your own interest, but also for the interests of others. One of the staff asked me to ask you this question. How do you feel like this, just dealing with this virus, has affected your own walk with the Lord? How that's impacted you?
I think that's a good question. I think it's drawn me into realms of looking at other people and looking at our society and trying to sort out, in part, to draw you back into what is important. And I think we've had some excellent sermons on that. But when your whole world gets flipped upside down, even my practice of medicine, which is uniquely different right now than it was 6 months ago, and I could have never predicted that. And I think that you can still have a peace in that change if you're founded in Christ and if you're founded in the Bible. And I think that it gives you strength to draw upon that. I mean, we have had some great family times doing church together that were much more intimate, but still real to us and still allowed us to grow. And I've been able to see other Christians, and I've been watching Britton Holman on Sundays with his music, and just how that speaks to me. Seeing how both Christians and non-Christians respond to it, it's kind of interesting. I see a lot of people that I firmly believe are Christians really struggling with so much now that I wouldn't have predicted, but yet it's interesting, and yet I see other people just as solid as ever, so I try to draw inspiration from my brothers as well. And even in the midst of hardship, I see people that from the outside you'd never guess what's going on in their life. And I've seen that historically with medicine too. I can give somebody terrible news, and there's a couple different ways that can be approached. I think everybody grieves kind of the same way as far as the scientific steps of grief, but how it manifests itself and what you can see in people is a lot different. And so I think hardship can kind of reveal where somebody is spiritually sometimes.
Well, do you think that maybe some of the anger and just kind of ambient anger in people is partially their response to just grief, that the world's been tipped upside down, and there's all of this upheaval, and there's And there's just, and people, when they're in pain, they tend to get angry.
No question. I mean, no question. It's it's interesting where we're at right now. I mean, we've had this whole protest thing going on right now, and the death of an innocent black man and in Minnesota. And now I think things are fermenting even more. I think in my life, I think that there's as much political divide right now as I ever remember since I was a young child, since I became politically aware, I guess. And I think it seems like everything's boiling up. And certainly when you tell people, hey, go hibernate in your house for 3 months, and then you
watch
put
the
all
news
of this,
24/7.
you put all of this together, it almost seems like this big powder keg. But
Well, we need to pray.
If there was a word of hope, I mean, I think that this too will pass, and I think we will get the semblance of our life back as we knew it. I can't tell you when, but I can challenge my brothers and just say, where will you be spiritually when that happens?
Yeah, that's the thing is we want to come out, saying, hey, we were focused on what really mattered. And that's so. Let me just close with this. As you look at it, what are ways that you think we can show love and care for for our church and for our community? What would you say are, like, to you really are important at this point?
Well, I think being aware of other people's needs and being aware of other people's lives and circumstance, that part hasn't changed. Their needs have changed. Even before at our office, even before we were masking, I had a couple of patients say, oh, I'm surprised you guys aren't masking. What's going on? Am I getting bad information? And even though it was only 2%, I was really convicted by that, to go, oh, wow, we're a healthcare facility. We're scientifically based. I need to look into this. I mean, if there's any benefit of this at all, then why wouldn't I? It's not like the freedom of wearing a seatbelt where I'm only going to harm myself. I mean, if I'm actually going to potentially bring harm to somebody. So looking at what their needs are, looking at others' needs, looking in the community, I think, there are people that aren't working, or that their businesses are not what they were 6 months ago. And that's a tremendous stress. There are people whose families who maybe spending 3 months tightly together wasn't necessarily a healthy thing. And they have needs.
You've been
maybe
talking to my college kids.
social needs, I mean, they don't have the support network of the community that they had before, and so how can you reach out and help people with whatever their needs are? I think you kind of alluded, like, reaching outside of yourself. I think the more focused internally we are on what's going wrong with me and what's going, we talked a little bit earlier about missionary medicine. One of the ways that God really used that to open my eyes is to see how good we've got it. And when I mean that, I mean not just in Lewis County, but the United States. The blessings that we have are so abundant relative to most of the rest of the world that it's kind of interesting. I know you know the story, Joe, but I went on my first mission down there because of my daughter, and I wanted to open her eyes. And I felt more convicted, I think, coming back on just how wrong my view of the world was, and how blessed we have it, and how I shouldn't be in political skirmishes. And not to say that we can't always do better, but I recognized I was too internally focused. How is this affecting me? Instead of, wow, I have so much. And I think the more that we can view that we have something to give and we can bless others, it brings a satisfaction and a happiness to your life that I think God wants everybody to experience.
That's great. Well, listen, I really appreciate it. And hopefully with all that's going on around, and a lot of things loosening up, and then also with a lot of people in kind of public settings, hopefully we won't see a resurgence of this. There's always that risk, but we're hoping that we're planning and hoping that we'll be able to have some in-person services as we go along. And I just want to thank you so much for your input in our community and your help, not just for me personally, but also for so many people that are going to be watching this. And I just want to tell people, hey, folks, if you have medical questions and you have science questions, I'm just going to refer you to people that know better than I do. So get ready, Rob. They're coming your way.
Oh boy.
All
Well,
right.
I mean, and I'll do the best I can with it, but I think sometimes my perspective and my sources that I go to may be different, but everybody's going to have to do their own research. Sometimes when you're desperate, though, going by the gut adage of trust your own intuition isn't always the best thing. And I'm always super happy to help anybody in the community, and especially anybody at our church. If they want to call me or just even ask Pastor Joe, happy to give you my number, and always happy to try to help you out.
All right. God bless you. Thank you, Rob.
Thanks, Joe.